This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hello, everyone. This is Andy Southerland from the University of Virginia. And for this week's Neurology podcast, I have the great pleasure of speaking with Dipika Aggarwal for our latest installment in the Physician as Patient series. Dipika is a clinical assistant professor of neurology at the University of Kansas Medical Center, but she's here with us today because Dipika is also a cancer survivor and a stroke survivor, having suffered an aneurysmal subarachnoid hemorrhage and ischemic stroke in 2019. Dipika, thank you so much for joining us here for this important Physician as Patient series in the Neurology podcast.
Thank you, Andy, for having me here.
Some of the folks out there may have heard your story already, Dipika. You've done a lot of advocacy and you shared your story across a number of platforms. I heard about your story from one of our prior interviewees on this Physician as Patient series, Dr. Amy Hessler, because you spoke with the Women Neurologists group, which is a group of obviously women professionals in neurology, and shared your perspective. But for those out there who have not heard your story, I'd like for you to just take us back to 2019 when your stroke occurred and tell us a little bit about what was going on in your life at the time and the initial shock of it all and how things transpired from there as you moved towards recovery.
Sure, yes. So actually, before my stroke story, which started in September of 2019, I would like to take you back by 15 months where exactly all the health problems started. That was in May of 2018. At that time, I was an early career faculty at the University of Kansas Medical Center. After my clinical neurophysiology fellowship, I was practicing in a general neurology outpatient clinic, doing lots of procedures, EMGs, Botox, then intraop monitoring. And life was good. Life was actually great. But then all of a sudden, unexpectedly, and I was diagnosed with stage 4 colorectal cancer in May of 2018. And that is what turned my life from someone who has never been on prescription medicines up till then. I had to face medications like chemotherapy and then procedures like radiation and surgeries. But then, of course, I had a lot of support and I fought through all that pretty good. And after a year of battle, and in about March of 2019, I was declared cancer-free or no evidence of disease. And then it took me a few months to get back to work. And by July 2019, I was back to work gradually. And then upon talking to the seniors in the department and the administration, we mutually made a decision that I want to work as a neurohospitalist. So I gradually started working in the hospital, rounding on the patients, working with residents. And then I remember August, entire month of August, I did that, but not alone. There was another colleague working with me so that the transition is gradual. And then by September, I was on my own. It was the first week when I was on the service and obviously taking full care of stroke patients, seizure patients, the general neurology ward service. And it was the next week was my week off. And I was literally enjoying life because getting 1 week off was really good. And I still remember the day. It was Tuesday and 24th September 2019. I had one appointment in the hospital because of the cancer. I still had the remaining outpatient follow-ups with different specialties. So I had an appointment in the morning. I went, attended my appointment. And then the next thing I was like, okay, I am free the rest of the day. I don't have anything urgent to take care of. And it's a Tuesday. It was really feeling very odd to have the day off during the week. So I decided that, okay, let's go and pamper myself. And I went to a restaurant, one of the a lunch and brunch restaurant. I was really a fan of that place. And I went there for a breakfast all by myself. And I was there I still remember I ordered a vegetable omelette and a coffee, and I was enjoying my breakfast. And luckily, that happened that I was texting a colleague and we were just discussing nothing fun. We were just discussing what the future call schedule is going to be. And suddenly I had a sharp shooting severe headache, and it was so sudden. And now in hindsight, that was a classic thunderclap headache, and I should have recognized it. Being a neurologist, that's what we tell all the patients, that, oh, if the headache is sudden onset, severe, call 911. But for me, I guess maybe I was in denial that something, or I did not consider myself as risk factors for stroke. So I was more worried about that. Oh, probably it's a bad migraine. The next thing will be I'm going to throw up, and I don't want to create a scene and spoil everybody's breakfast in the restaurant. So I was like, okay, I will just quickly pay my bill and go and sit in my car outside and wait for 15 minutes before I drive home. And then at the same time, Brennan, she texted me back that, do you want me to come and pick you or give you a ride? Or do you want me to come and get you from the restaurant and take you to the hospital ER? And I was joking with her, no, I'm neurologically intact. I don't need to go to the ER. And I think it's just a bad migraine. So she was like, okay, fine, that's fine. Then you go and sit in your car for 15 minutes and see how you are. And if you still need a ride, I can come and get you from the parking lot, wherever you are. The only positive thing was that she knew the name of the restaurant, but there are 2 branches of that restaurant near the hospital. So she didn't know at which particular place I was. But then, so in about 15 minutes, she started texting me, no reply. She started calling me. I was not answering my phone. And then at one point, all this is like what I was told later on, that at one point I answered and I was slurring my speech, slurring my words. And then she thought that, okay, I need to drive to and find her. So there were 2 locations of that particular restaurant. So first she had to look for my car and find me in the parking lot. So it's not even that she can call 911 directly from wherever she is, because my location is unknown. So she came to the parking lot. She was finally able to locate me, find me in my car. By that time, I have no memory of all this, but according to her, then I was awake, but I had a facial droop. So she called 911. Obviously, I was absolutely altered and I was not comprehending, not making any sense. So she called 911. Then I was pretty close to the hospital, and obviously University of Kansas Medical Center. It's a comprehensive stroke center. So that was obviously the first location EMS would have taken me. And at the same time, she called the hospital stroke team that this is what I found Dipika in this state. I'm sending her to the ER. And obviously I was taken to the ER. Stat CT scan showed a 2 millimeter MCA aneurysm. What are the odds? A 2 millimeter. And then obviously, of course, after that, the entire ECTA, obviously, then they took me to IR. They could not coil the aneurysm. So I had to go to emergent craniotomy for clipping of the aneurysm. And then so the other thing was that since I am the only person like from my family, like I'm here alone. So they had to call my brother on the phone to get his consent and my family. So now they are on their way to Kansas City. So my brother lives in California. He's on his way to Kansas City. And then obviously by the time I have the surgery done, it was almost by midnight, I was brought to the ICU and I was still intubated, obviously. And the next day I was extubated. And from what I remember, that is somewhat from the next 15 days I was in the neuro ICU. I have little bits and pieces of memory. But what I can tell that when I regained consciousness, my first impression was, why am I wearing the patient's gown? And why am I in the hospital, in the room? And why is my brother next to me? And why am I having difficulty in moving my right side of the body? And why am I having trouble understanding what people are talking? So all that made me realize that I'm not the physician here. I'm the patient. And I think that's what my understanding is. And then I don't know if it is actually, I was able to realize all that. But that was the time when actually it made me realize that I've had a stroke and I have weakness or hemiplegia on my right side and I was aphasic.
My goodness. Dipika, unbelievable story. Cruel joke that it would be to be in that position of coming to the realization that you're the patient in that environment and not the physician, but really the culmination of it to have survived, beaten a terrible diagnosis of cancer, to have rebounded for that over 15 months through treatment, I'm sure was its own measure of endurance, to then return back to work and really have that optimism of returning to some degree of normalcy in your life and doing the most mundane thing you could be doing, which is to enjoying your day off and enjoying a brunch. It's a tragic story, of course, which I hope through all this that we're going to obviously be able to tell the happy process of your recovery and the resilience of all that. But at least in the moment, it's just unfair. And I'm sure like anyone listening to this is just thinking it's this terribly cruel thing that happened. Certainly worth saying, clearly grateful that you were talking to your friend who was obviously someone in a position that could recognize what was going on and could get to you, as opposed to being in a place where you were by yourself and things could have gone another direction. Obviously to the staff, the team, the Comprehensive Stroke Center there at the University of Kansas, who clearly did what they had to do to treat your aneurysm and save your life. So all that is clearly important. But as you then go through that process in the early days, I'm confident that the primary attention is just on getting through the critical care portion of it. The same thing we advise to our patients, taking it one day at a time. Take us now, Dipika, into the process of really trying to clearly move into a recovery phase and what you had to do to get there with the deficits that you had. But then I know that part of your story, and you've been outspoken about this as well, is the psychological impact of what happened to you and how that is something that we can learn from in the care of patients, particularly stroke patients and other patients with neurological disease when something like this occurs. Can you share a little bit about that with us?
My recovery, I would say that it was challenging, not only just challenging, but it was also complicated. And because of, I needed multiple hospitalizations because of abdominal issues and then a repeat abdominal surgery. And by the time I was done with all the hospitalizations, it was April 2020. And when I was ready for my outpatient therapy, it was time for universal lockdown because of the pandemic.
Oh, goodness. One thing after another.
So my outpatient therapy, in fact, actually was through tele. So I did tele rehab for another year. But then that time, a lot of changes happened in my personal life. So first it was my engagement that broke up. But then not only that, as if all these were not enough, then my father suddenly, he passed away. He was perfectly healthy and everything was fine. And then next thing we know that he just passed away. So all these, it was like not just one thing, all that transformed me to like in a mental health, like crisis situation. It was bad to an extent that I literally wanted to end my life. But then was it all the neurochemical or neurotransmitters changes that are happening in the brain because of the stroke, or was it my personal life, or was it my family, or was it just a combination? Nobody knows the answer to that. But that made me like, obviously the first thing I did was to take care of my mental health, and gradually I'm doing better. But all these things from my personal experience made me realize the importance of addressing the neuropsychological complications of stroke. That is something that can affect a stroke survivor's life, that can affect their recovery, affect their morbidity and mortality, everything. So the more I started looking into what all neuropsychological complications like post-stroke depression, post-stroke anxiety, post-stroke fatigue, post-stroke apathy, they can be present up to, all the literature says that about 1/3 of the stroke survivors, or they suffer from post-stroke depression or anxiety. In my experience, I don't think so. It's just 1/3. What I have seen, like my own experience from the patients and then my stroke support group, it's more than that. And there is no limited timeline that it can happen just only in the first year or can last for this much time. Now looking back, my depression just started right after stroke. I could clearly see myself having the post-stroke apathy initially. That is obviously completely gone now. But post-stroke depression, yes, I still am suffering from post-stroke depression, and I have no problems with sharing it, because the reason is that this has made me much more able to understand the patients better and asking them more questions about how they are doing, as far as not only physically, or asking them their secondary stroke risk factors, that, oh, is your blood pressure controlled, or we need to just check your lipid profile, or are you taking your aspirin or anticoagulation? No, it makes me more, I want to ask the question that how are you doing mentally? Or ask the family member or whoever is coming, whoever the caregiver is, how are they doing otherwise, like emotionally, how are they doing? So because I realized that mental health is equally as important as physical health in any chronic illness, but especially in stroke, because if I would not have taken care of my mental health, I don't think so I would have been here the way I am, again, back to work. Yes, it is modified back to work, but again, I am fully independent. I am working full time. So taking care of the mental health, it is very, very important.
Dipika, that's a great segue to one of the things we like to really try to tease out from these physician as patient series is what are the ways in which the experience of this has changed you as a neurologist, and are there specific recommendations that you have now for your colleagues on things we can do better? And as a vascular neurologist, stroke specialist, I can say it's easy to fall into that trap of just asking sort of those checklist questions about stroke risk factors and the things you know you're going to get a quick answer on, and you're busy moving through your clinic, and asking that open-ended question about how folks are doing mental health wise, their personal life, etc. They often require more time, but they're, as you point out, so critically important to people's recovery. Of course, we have PHQ-9 screening mechanisms and so forth, and all that is important. I assume you would endorse it doesn't replace probing in a more empathetic way as to what's going on internally and in someone's personal life. So that's a wonderful message to share, and one that you do share. I want to make sure we highlight in the podcast today. Not only are you talking with us about this and you've talking with these other groups, but you are truly a leader now. You mentioned your own stroke survivor group that you started there at the University of Kansas, but you're leading at the national level, doing a lot of advocacy work with the American Heart Association and so forth. Is there anything you'd like to message, implore for the neurology listeners out there about your advocacy work, or ways that people should get involved, or more specifically, ways that one or two pearls that you'd like to highlight for folks to do better in their care of patients with neurological disease and stroke, obviously, specifically?
One of the messages that I would definitely like to convey to my colleagues is that always try to motivate your patients or the stroke survivors, and with the bullet points that stroke recovery does not have an expiration date. I have seen so many stroke survivors who come to the clinic and say that, oh, my primary care told me that after a year there is no recovery. No, that is not true. I am almost 7 years out of my stroke. I'm still doing therapies and I am still improving. So that is what I want all the healthcare providers to remember and to tell their patients, that always encourage them and telling them that stroke recovery does not have an expiration date. Continue therapies or self exercises, and you will continue to get better. And then the second point, which I would really like to make, is that every healthcare provider, especially the neurologists, always ask your stroke survivors about their mental well-being. It is as important as checking their vitals on every follow-up appointment or every interaction you have with them. It's not necessary that, you ask them about their emotional well-being last appointment, last visit, which was however many months ago. But no, it is important to ask them about their emotional well-being or ask the caregiver about how they are doing emotionally.
Dipika, thank you for sharing that. And again, I just continually be amazed during these interviews, and especially this one with you today, about how you can endure so many different collective tragedies all happening over the course of an entire lifetime, let alone in a contracted period of time in the prime of your life like you've endured, both the medical tragedies when you're cancer and your stroke, and then the personal tragedies combined, and to somehow be able to pick yourself up through that, survive it mentally, physically, and now back to work as a neurologist. It's really just incredible. And I thank you. I'm grateful to you and proud to know you, proud to call you a colleague. So really thank you for being here with us. The more of these we do, it's always just so good to remind everyone out there that whether it's an outward obvious health condition that people are going through or something personal going on in their lives we don't even know about, but everyone has things they're dealing with. And when we're physicians, neurologists, we feel like that sometimes we can't fully express the vulnerability of all that. And it's important to look out for each other through it as well. Dipika, thank you so much again. I look forward to seeing you on more stages as you continue to champion stroke survivors and stroke recovery. And it's fair to say that you've had enough of tragedies for one lifetime, and I wish you all the very best. And I hope you get to enjoy many more of those omelets in peace and health and happiness in the future. Okay. Thank you so much. Again, this has been Andy Southerland speaking with Dipika Aggarwal, sharing her story of survivorship from stroke and cancer and all manner of things with us here on the Neurology Podcast. Thank you for listening, and we look forward to sharing more in our Physician as Patient series.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes, or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.